Usha Mohan and welcome to Medical Dialogues Journal Club today, your daily dose of health and medical news. Here's what we have for you today. The American Academy of Orthopaedic Surgeons released new guidelines for the management of knee osteoarthritis. Pre-hospital plasma transfusion found to be cost-effective and life-saving for unstable trauma patients. Neonatal stimulation more effective with cord intact than those with early cord clamping. Hypertension can be best diagnosed from the comfort of your home. Fructosamine complements HbA1c for accurate glycemic control in diabetes on dialysis. The American Academy of Orthopaedic Surgeons has released new clinical practice guidelines for the treatment of knee osteoarthritis in adults. It provides recommendations that will help practitioners to correlate the existing evidence with clinical practice. This guidelines list, published in the Journal of American Academy of Orthopaedic Surgeons, is intended for use with adults aged 17 years and older who have been diagnosed by a trained healthcare provider with osteoarthritis of the knee and who are undergoing treatment. The recommendations include lateral wedge insoles are not recommended for patients with knee osteoarthritis. Canes could be used to improve pain and function in such patients. Brace treatment could be used to improve function, pain and quality of life in patients with knee osteoarthritis. Various supplements may be helpful in reducing pain and improving the function for patients with mild to moderate condition. Topical NSAIDs should be used to improve function and quality of life for such patients. Supervised exercise, unsupervised exercise and or aquatic exercises are recommended over no exercise to improve the pain and function for treatment of knee osteoarthritis. Neuromuscular training that may include balance, agility, coordination. Such programs in combination with traditional exercise could be used to improve performance-based function and walking speed for the treatment of such patients. Self-management programs are recommended to improve pain and function for patients with knee osteoarthritis. Patient education programs are also recommended that will help improve pain in such patients. Sustained weight loss is also highly recommended and that will in turn improve function in overweight and obese patients. Manual therapy in addition to an exercise program may be used to improve pain and function in patients with knee osteoarthritis. Massage may be used in addition to usual care to improve pain and function. Laser treatments as approved by FDA may also be used to improve pain and function in such patients. Acupuncture may improve pain and function, also found to be a highly recommended guideline. Transcutaneous electrical nerve stimulation also helps in pain relief. There are various other pain management modalities that have been included in the recommendations, including percutaneous electrical nerve stimulation, pulsed electromagnetic field therapy, most importantly for pain, extracorporeal shockwave therapy, oral NSAIDs, oral acetaminophen, oral narcotics including tramadol result in significant increase of adverse events and are not effective in improving pain or function for the treatment of knee osteoarthritis. Hyaluronic acid intra-articular injection is not recommended for routine use of such symptomatic osteoarthritis conditions. Intra-articular corticosteroids could also provide short-term relief for patients with symptomatic osteoarthritis of the knee. Platelet-rich plasma, abbreviated as PRP, may help reduce pain and improve function in symptomatic conditions. Denervation therapy may reduce pain and improve function in patients with symptomatic condition. Arthroscopy with lavage and or debridement in patients with a primary diagnosis is not recommended. Arthroscopic partial meniscectomy can be used for treatment of meniscal tears in patients with concomitant mild to moderate osteoarthritis who have failed physical therapy or other non-surgical treatments. High tibial osteotomy may also be considered to improve pain and function in properly indicated patients with unicompartmental knee osteoarthritis. These are the various recommendations that need to be followed by healthcare professionals. Pre-hospital plasma transfusion is life-saving for patients in hemorrhagic shock, but it is not commonly used owing to cost and feasibility concerns. A recent research published in the Journal of American Medical Association demonstrated that pre-hospital third plasma transfusion during medical evacuation for trauma patients in hemorrhagic shock was life-saving as well as cost-effective relative to conventional treatment and should become the standard practice. The trial included 501 patients. Median age of the patients for standard care were 44 and 46 years respectively. Overall, around 72.7% patients were included as males. Pre-hospital transfusion, short-term inpatient treatment, lifelong healthcare expenditures and quality of life outcomes were all taken into account. The results showed that pre-hospital third plasma was more cost-effective than standard care resuscitation in a cost-effectiveness model based on a data from a randomized multi-center clinical study. The authors finally stated that pre-hospital third plasma might be life-saving and cost-effective, and that it should become a routine component of resuscitation for trauma patients in hemorrhagic shock during air transport. Globally, among the 140 million neonates who are born every year, 10 to 15 million do not cry or breathe at birth. These neonates may require resuscitation to transition from the intrauterine to the extrauterine environment. The commencement of breathing and the transition of blood flow from the umbilical to the pulmonary circulation are the two major physiological events leading to the extrauterine transition. The International Liaison Committee on Resuscitation 2020 recommends that a neonate who is not crying or breathing with poor tone and heart rate less than 100 beats per minute should receive stimulation and clearing of airways as and when needed with an intact cord. Resuscitation with cord intact may provide a smoother cardiopulmonary transition at birth. Also, the WHO recommends, if there is experience in providing ventilation without cutting the umbilical cord, ventilation can be initiated before cord cutting. Despite guidelines and educational programs on delayed cord clamping, healthcare professionals, especially in low-middle income countries, often clamp the cord early prior to resuscitation. In a recent observational study published in the BMJ Pediatrics, included a total of approximately 3,000 non-crying neonates with a gestation of more than 34 weeks who received additional tactile stimulation. Of the neonates that were stimulated, 26.2% of them had their cord intact, while 73.8% had their cord clamped. Researchers observed that a higher proportion of the neonates were breathing in the group with cord intact as compared with the group cord clamped. The authors then concluded that there is a need to implement a delay in cord clamping as a quality improvement intervention to improve initial steps of resuscitation, especially stimulation and, if necessary, bag and mask ventilation. Keeping the current situation of the COVID-19 virus, blood pressure rise among populations is quite common. Monitoring blood pressure is usually recommended to be done by a healthcare worker until recently an interesting study presented during the virtual American Heart Association Hypertension Scientific Sessions 2021 has mentioned that adults who need to track their blood pressure to find out if they have hypertension prefer to do it at home rather than at a clinic or kiosk or with a 24-hour ambulatory BP monitoring device. The BP check study was a 3-group randomized controlled diagnostic study that tested the accuracy and acceptability of home, office and kiosk BP monitoring against the gold standard for diagnosing hypertension. The trial enrolled 510 adults with elevated BP who had not been diagnosed with hypertension. They were divided into 3 groups: at the clinic, at the home or even at the kiosk. These assigned to clinic measurements were asked to return to the clinic for at least one additional BP check, as it is routine in diagnosing hypertension in clinical practice. Those in the in-home group were given and trained to use a Bluetooth web-enabled home BP monitor and were asked to take their BP twice a day for 5 days, while those in the kiosk group were trained to use a BP kiosk with a smart card and were asked to return to the kiosk or to a nearby pharmacy within the same kiosk on 3 separate days and measure their BP 3 times at each visit. The results showed that adherence to the monitoring regimen was highest in the home BP group, accounting for 90.6%, followed by the clinic group, and it was lowest in the kiosk group, accounting for 67.9%. Therefore, the authors stressed that patients with hypertension should have a blood pressure monitor at home that is validated and should be instructed in how to use it properly. Evaluation of HbA1c by continuous glucose monitoring underestimates the plasma glucose levels, especially in patients with type 2 diabetes, those receiving hemodialysis, and for optimizing the blood sugar control. Underestimation is a clinical challenge. Now, a recent study states that fructosamine is not affected by the factors affecting HbA1c, and that may be more of an accurate measure for glycemic monitoring. Thus, continuous glucose monitoring or fructosamine could complement HbA1c for getting a more accurate blood sugar control in T2D patients receiving hemodialysis. The study published in the Blood Purification Journal highlighted that patients were categorized into 2 groups, one that was receiving the hemodialysis and the other that was categorized as the control group. All the patients completed the study in a period of 17 weeks. It was found that the mean sensor glucose was 1.4 milliosmol per liter, whereas the difference for controls was only 0.1 milliosmol per liter. Hence, the authors concluded that fructosamine is unaffected by the factors affecting HbA1c and appears to be more accurate for glycemic monitoring. That's all for now from us. I'll see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.